What is an artificial disc replacement, also known as ADR or TDR for total disc replacement? It involves removing a degenerated or painful disc and replacing it with a device that's designed to mimic that function and motion of that disc. Similar to the way you would undergo a hip or knee replacement. Hips and knees are joints that are meant to move and can be replaced with devices that mimic that function and motion. Similarly, your spine is made up of joints that are meant to move. Each level of your spine is supported by a disc in front and two facet joints in the back at each level. The main support of the spine are the discs, and each of these discs are meant to move. A long time ago, if you had a bad hip or a bad knee, you would get your hips or knees fused, and you would walk around with a straight leg and your joints would not be able to function properly. And today that seems like such a morbid procedure. The same principle applies in the spine, which are made up of joints that are meant to move. We can get away with fusing a level or two in our spine because we have other discs to make up for that lost motion. Specifically, we have 5 discs in our neck and 5 discs in our low back. This is an example of a fusion where the clear acrylic here is the bone, your screws and rods and cages that are meant to fuse these two bones together. Here's an example of a lumbar artificial disc. Again, the clear acrylic represents the bone. The device in between is the artificial disc. This is what it looks like pulled apart. It's designed to bend forward and bend backwards, bend sideways, and even rotate. It's important to note, however, that there's still 2 facet joints in the back that move and have to be relatively disease-free in order for this device to work well. What happens during cervical disc replacement surgery? Well, after the anesthesiologist puts you to sleep, you're positioned flat on your back. We make an incision along the side of your neck, and that's the only thing we cut is the skin. That's why it's relatively pain-free. Your trachea and your esophagus are moved to the side, and your blood vessels are moved the other way, and we're staring straight down at the spine. And then we carefully remove the disc using a high-powered microscope, making sure that your spinal cord and all the nerves are completely decompressed. And then we implant the device using intraoperative x-ray, making sure that it's positioned appropriately. Then we close you up with dissolvable sutures, so nothing has to be cut out or removed, put on a Band-Aid, and most patients go home the same day. Some stay overnight, especially if you're having multiple levels that are being done. What happens during lumbar disc replacement surgery? Well, after the anesthesiologist puts you to sleep, you're positioned again flat on your back. And the difference with this is I use an access surgeon. An access surgeon is generally a trained vascular surgeon whose job is to provide access to the lumbar spine. Your intestines and guts and everything live in this bag called the peritoneum, and it's just moved aside. We don't go through it, we go behind it. And then once access is provided, I'm staring straight down at the lumbar spine. The diseased disc is removed and the device is implanted using intraoperative x-ray. And then we close you up. Generally, we admit you overnight, slowly advance your diet, and get you up and walking right away. For the cervical spine, we typically do not recommend a hard cervical collar. You may wear a soft collar for comfort while the incision is healing for the first week or 2. Similarly, for the lumbar spine, you may wear a lumbar corset for comfort while the incision is healing. It typically takes 2 to 3 weeks for the soft tissues to heal, and it takes about 4 to 6 weeks for the bone to heal. But there's ongoing bone remodeling that occurs for months thereafter. The bone, as it heals, actually grows into the pores of the implant. I wait about 6 weeks before starting physical therapy, which means for those first 6 weeks, no aggressive neck range of motion exercises for the cervical spine, no aggressive low back range of motion exercises for the lumbar spine. You can expect to return to full activity without restrictions at 3 months.